everyone. So my name is Christopher Xenakis, and today is March 25th, 2002, and I'm doing the Pathophysiology Week 2 assignment, so I'm just going to get started. So the first uh, word that we had to define was disease, and that can be defined as like an illness or an altered state of the body that someone can either obtain or be born with that causes disruption in the body. An example can be like Alzheimer's disease, which causes the connections between one's brain cells to degenerate and die, which can cause memory loss and impair mental functions. And in order to classify a disease, one can do so by the patient-specific region of the body or system, uh, either like anatomically by the organ or the tissue. They can do it also by like physiologically by what the functioning is, pathologically also, as in the specific ways the disease is progressing, and etiologically or what the specific cause or causes are, epidemiologically, and also even statistically. Etiology is the specific cause or causes of a disease, and can involve many like etiologic factors, such as like biologic or chemical agents, genetics, even malnutrition. An example is someone who lives in like a lower class neighborhood may have access to contaminated water that can cause sickness in the population. So the etiology of E. coli is the bacterium that causes like cramps, diarrhea, vomiting, etc. And next we have pathogenesis, which is the development of events that take place when someone comes into initial contact with the cause of a disease until the eventual manifestation of the disease. An example is the process of inflammation, in which there's a sequence of events that take place from the point of initiation, such as like trauma, to the final point of like reaction in the body. And symptoms are feelings or complaints that the patient, him or herself, tells the medical provider. Examples are stomach cramps, headaches, fatigue. So these symptoms are more subjective, something that the doctor cannot physically prove or evaluate because he or she is not the patient and cannot feel these things. Signs are signs are indications or expressions that are made by the patient that a medical provider can physically observe and evaluate. Examples can be blisters, runny nose, and increased heart rate, which are the doctor can physically measure that. And a syndrome is a collection of all these signs and symptoms that a patient expresses that occur together that can indicate someone has a disease or that it's leading up to a diagnosis of a disease. An example is something called like irritable bowel syndrome, which is chronic and can affect the large intestine and involves like abdominal pain, bloating, constipation, and so on. And a diagnosis is the recognition of one's illness and or health problems that after examining all the symptoms and signs that a patient expresses, performing the appropriate tests such as blood work, biopsies, etc. It almost acts like the ultimate label for the patient, where thereby treatment can then be made for this confirmed diagnosis. And examples of this can be after a physician evaluates someone who states like she frequently has difficulty breathing, fatigue, severe headaches, and who has an irregular heartbeat, they can have a diagnosis of hypertension. And complications are problems that can occur during a disease's process, or even after a procedure or treatment for that specific disease that can lead to pretty much unfavorable effects. Examples of this are possible infections, bleeding, or even blood clots that can occur during surgery for a tumor removal, let's say. And a prognosis is considered the forecast, you can say, or likely outcome or course of a disease or ailment. For example, going back to cancer, the prognosis for lung cancer can be what is considered, let's say, a 5-year survival rate, but this also depends on many factors like the stage of the cancer, the age of the patient, and so on. And then lastly, diagnostic tests. These are procedures or examinations used to confirm or rule out a disease or ailment. Medical professionals will use these as their most concrete and kind of critical basis of information in order to correctly diagnose. And an example is a colonoscopy, which is done to evaluate the colon for cancer or growths, usually done for patients over 50 years old. And that's about it. Thank you so much for listening, and good luck in the class.